Many men don't know the early warning signs that something's wrong.
That's not an individual man problem. We're not doing the services right.
That's how we've got to shift our perspective, right?
But what we're talking about is our friends, our brothers, our fathers, our work colleagues, our partners. It's the people we live and work with, people we care about. Okay, I'm going to go anti-clockwise.
Men's mental health. What do you think about that, Paul?
For sure. I mean, the biggest issue that we face in relation to men's mental health is suicide. Like 3 out of every 4 suicides, 75% of all suicides in this country are men.
I think when I learnt that statistic about it being the biggest killer of men under 50 at medical school, I was like, no, someone's got that wrong. I couldn't believe it.
Unfortunately, the way that we view mental health and the way that a lot of men end up engaging with mental health services is when they start to get really poorly or things start to hit a crisis point.
Many men don't know the early warning signs that something's wrong. Sleep, appetite, obviously mood, sexual appetite as well.
The men's tendency to want to solve their own problems, be self-reliant, not express emotion. We know that
considered feminine, right?
Yeah.
Just to express it even.
Exactly, and it's how a lot of boys and young men have been brought up. But we need to flip that really, I think, and think about how can we leverage those aspects of being a man. Seeking help can be seen to be a courageous act. Friends looking out for other friends, spotting those signs, helping them. We know that men are great at that. Men getting care. Unlike women, men don't tend to have a natural point within their life where they have to engage with healthcare services and become familiar with them, as a lot of women do through fertility and childbirth, whereas men tend not to develop that familiarity, which can make the space feel more feminine or more uncomfortable.
I think in terms of accessing care, I'm so less likely to see a working age man come in and then actually booking the appointment as a GP in London. It's hard for them. They prefer remote care because then they can control the environment and feel a bit more comfortable.
Yeah, comfort's a big thing that comes through, I think, in the evidence, and ease of access, because we often think that the thing that's underpinning men's poorer or less engagement with primary care services is that they don't want to go to the doctors. But we know that they do, but there's a lot of barriers, both cultural and structural, so ease of care, time, particularly for men who are working full-time.
Men often don't come to the doctor because they are working. You know, if they're at work, approaching them there is a beautiful opportunity to access them when they're in a safe space.
Totally, and we know that those types of walk-in services or services that are delivered in non-traditional settings can be more appealing and engaging.
One of the best schemes I've seen is like bringing in a kind of barber to work and then having men go there and approaching them, again, not all men, but it's a great space where it just changes the narrative and makes it more approachable to discuss difficult topics.
Yeah, not overly serious.
Yes.
There are examples of where health professionals have been dressed in tracksuits or in sports type gear and delivering those services out in sports community settings, and it feels more lifestyle related rather than healthcare type of threat. 65% of all premature deaths in men under the age of, that means under the age of 75, are by preventable risk factors, lifestyle factors. So we could address a lot of the premature death in men in society by tackling things like diet, exercise, alcohol consumption, and smoking. I'm interested to know what people's experiences are in terms of what works and what doesn't. Like some of the things we know that works, like in, for example, weight loss, is not trying to design a service like are available for a lot of women and those types of things, and weighing yourself, but more focused around
fitness groups,
fitness and energy and performance, and delivering it in settings that men feel comfortable with, like sports stadiums, football clubs, community areas, and being around other blokes as well, making it fun and humorous and not overly serious.
We had some good work go into kind of exercise on prescription, like a subsidy that you could use at a health club. Like, I feel like I discovered kind of group fitness classes and it changed my life.
Yeah.
And it really is, to me, whether it's men or women, you know, whoever you feel comfortable around, really,
Yeah.
isn't it? It's about making sure that you exercise together, even as a
Yeah.
family.
Yeah.
That's what makes a sustainable change rather
Yeah.
than a fad of,
Yeah.
right, I'm going to lose this many pounds for this wedding
Yeah.
or this event. It's about that long-term living healthily, isn't it?
We have to go beyond just telling men you need to do this or you need to do that, or it's okay to talk, or you need to lose weight, or you need to reduce your alcohol consumption. There needs to be more service delivery. So the barriers are not just in terms of men's awareness, it's going the next stage and saying, and this is the support that you can get, this is the help that we can provide, this is how we can give you the tools in order to make those changes. We know that men not just less likely to engage with a lot of healthcare services, unfortunately, they're more likely to drop out. That's not an individual man problem. We're not doing the services right because it's not speaking to their needs. So thinking about how can we overcome some of those misconceptions or fears that men might have at the point that they experience and engage with the service, so that they think, yeah, this is not as bad as I thought. This actually has been designed for me. This is for guys like me.
I agree. No, so I think what we're getting at there is the intersectionality, right? Like, so man, like person of color, queer, whatever layer you want to add on, like there's definitely no one size fits all solution. And it can be, I found a successful way is like specific clinics targeted to certain groups. So we might have an evening clinic. And again, because of the work hours, it's hard sometimes to find an appointment. And so having a targeted clinic for maybe obesity in the evening, and specifically like it's a men's clinic.
It's all about, thinking about designing services and health support systems so that men look at them and say, that is for men like me. So I found that really helpful in thinking about what would men say if it was for someone like them, and what does like them actually mean? Does it mean somebody who's working in a manual trade, who it's not easy for them to get time off throughout the day, or is it somebody from an LGBTQ plus background who has particular needs and wants to be delivered services in a particular way in a particular location, or is it men working in the city? All these different things we need to think about in designing services with men in mind, because as we know, 50% of the population, we have very different group. And I think when we talk about men's health, it can feel a little bit abstract, but what we're talking about is our friends, our brothers, our fathers, our work colleagues, our partners. It's the people we live and work with, people we care about. And we, as I said, healthier men lead to healthier communities and benefits the health of women as well.
What are your views on the men's health strategy? Submit your information via the link below.